And at this point, now we have our lines attached to our lift, except again for the topmost that supports the head. That'll be for the respiratory therapist, will support the head and the endotracheal tube. So now we are ready to lift the patient. You only need to lift them up to the point of getting the tortoise to be placed underneath. The break of the tortoise will be positioned underneath the shoulders. So it is the opposite way that we normally place. You want to be sure that the patient is centered in the bed, and you want to be sure that the tortoise is centered in the bed. The break will be folded underneath, and the top of the tortoise must be positioned with the patient's shoulders. Just going to show you. Okay, so it needs to come up just a little bit more so it is level with her shoulders. She is centered in the bed, and then we are ready to place the patient down while supporting her head. Okay, oh, and then we also do need to position the tortoise positioner at the head in a C shape, so you can mold it so that the patient's endotracheal tube holder is suspended off of the bed. It is a little bit difficult initially to position and shape, but you do want to assure that there is pressure off the endotracheal tube and the holder. When that is positioned, then you can boost the patient, center the patient, and again, making sure the tortoise is in the proper positioning before lowering the patient onto the bed. Okay, and just recheck that the endotracheal tube is in the proper position. And then remove the lift. And then you will be placing the patient in a swimmer's position with the arm opposite of where the head is facing, in a bent position, with the other arm down next to the patient with the palm up. A sure anatomical placement. Just going to again come back up and show you that the pressure is off the endotracheal tube there. And then we're ready to place, make sure your EKG leads are in place, your Mepilex, and everything else is in place for your patient. Then the patient to change position. We are going to change the position of the patient's head and arms and endotracheal tube on a prone patient every 2 hours. So we're going to just demonstrate changing the swimmer's position. We're going to bring the one arm down, turning the head with the endotracheal tube, repositioning the tortoise positioner, and bringing the patient's other arm up. And then when we are ready to supine, we're going to do the opposite. We are going to remove the leads from the patient's back. We will use the ceiling lift to remove the tortoise, and then we will burrito roll the patient just like we did, again with respiratory at the head of the bed, assuring that endotracheal tube is always in proper positioning with the lines and drains towards the foot of the bed and making sure they're secure. Thank you. I hope this was helpful.